It's 104.8 Channel 4. Hi, I'm Jade and I'm joined by Dr. Vishal, specialist neurologist at Prime Hospital. Thanks for joining us today.
Thank you so much. Thank you.
We're talking about vertigo. So what is vertigo and what are the symptoms that patients commonly have when they visit a vertigo clinic?
So vertigo is a false sensation of movement, often described as spinning or whirling. It's the most common symptom of balance disorders, and it significantly impacts the patient's daily activities. And vertigo is a symptom and not a disease in itself. And patient needs consultation to find out the cause of vertigo, whether it is brain-related or inner ear-related. And looking at other symptoms with which patients present to vertigo clinic are disorientation, that is dizziness, visual disturbances like blurring or tilting of vision, unsteadiness, fear of falls or actual falls. And some patients also report brain fog, difficulty in focusing and concentrating, lightheadedness and fatigue, which affects their quality of life, and it can even affect the mental health.
And why is it such a significant health concern in the UAE?
If we look at global statistics, up to 20% of adults experience these symptoms annually. And if we apply these statistics to current UAE population, around 1.65 to 2.2 million individuals suffer from vertigo and dizziness annually in UAE. And if we look at our experience in vertigo clinic, there are several patients who suffer from this condition. And that's why it is very important to increase the awareness about this condition, and so that they can manage these symptoms with lifestyle modification and the treatments.
Do you know why it happens?
Yeah. So if we look at the causes of vertigo, they can be either related to the ears or inner ear. There is a balance control system, a software we can say, and it is connected to the brain. So the causes of vertigo are either brain related or inner ear related. The causes which are related to the brain can be sinister and can be serious. So it's very important that to find out the exact cause of the vertigo and to treat it properly. And if we look at the triggers, like in a given patient, triggers can be positional changes like while getting up, lying down or turning in bed, or head movements like turning head side to side, up and down, or certain visual stimuli like scrolling the mobile screen, watching the desktop, or watching reels, complex lights in malls and supermarkets. So there are various triggers and which help in diagnosis. Patient to patient, the triggers are different, and these triggers help us in appropriately diagnosing the patient, whether it is inner ear related or brain related.
Dr. Vishal, specialist neurologist at Prime Hospital. If you enjoyed the interview today, you can check it out again on our podcast section. Go to channel4fm.com. You can also download the Channel 4 app. Go to Jade's Juice and you will find the full podcast on there. It's Channel 4. It's 104.8 Channel 4. Hi, I'm Jade and I'm joined by Dr. Vishal, specialist neurologist at Prime Hospital. We're talking about vertigo, and with the dizziness, what about when people are driving?
Yeah, so there is one form of dizziness which specifically occurs while driving a vehicle, whether it is a car or any other vehicle, and it is called as motorist vestibular disorientation syndrome. And looking at complexity of roads in Dubai, I have seen like one of the largest number of patients in the world, and I published one article regarding this 2 years ago. And this kind of dizziness gets triggered by high speed, bends and turns, multi-lane highways, and looking at other vehicles while driving. And it is a completely treatable condition by, it can be treated by a kind of therapy called as vestibular rehabilitation therapy. And with the help of medications, the patients can resume back their driving.
I mean, it can be quite busy out there and overwhelming, can't it, on the roads? In terms of myths about vertigo, what are they?
Yeah, if we look at the common myths which I see in my outpatient vertigo clinic, first myth is migraine only causes headaches and it doesn't cause vertigo. But in fact, migraine is one of the leading cause of vertigo and dizziness worldwide. It is called as vestibular migraine. It may present alone with vertigo, or it can present vertigo with headaches. And 1/3 of the patients with vestibular migraine may not even recall having typical migraines or might consider their headaches as normal. And that's why there is a confusion in the diagnosis and confusion, and there is a less awareness and acceptance about this particular diagnosis. The second common myth which I commonly see in my clinic is neck-related issues are more common cause of vertigo, like cervical spondylosis. But in fact, true spinning vertigo is very rare in patients with neck issues. And in reality, as I told, vestibular migraine and BPPV are more common causes, and cervical problems may lead to imbalance and dizziness in certain situations. But it's always important to look at a specific diagnosis, to conclude at a specific diagnosis before labeling it as a neck-related issue. And the third and last common myth I see is vertigo can only be treated with medications. It's not true. Medication is not answer for all types of vertigo. There are specialized repositioning maneuvers which are done for BPPV, which is a common condition because of crystals in the inner ear, which can be repositioned by these maneuvers. And vestibular physiotherapy also helps in many patients. And there are certain lifestyle modifications which are very important in vertigo patients, that is having a fixed timing for their meals, fixed sleep-wake routine, reducing their screen times, having good water intake, and reducing their stress. These are the very important lifestyle modifications to, take care of vertigo and headaches.
Yeah. Okay. Well, thank you so much. And what advice would you give to somebody who maybe doesn't know if it's vertigo? Would you say to get checked up anyway?
Yes, because detailed history taking and examination of the patient and doing their testing to rule out serious causes of vertigo versus less serious causes, and giving appropriate treatment to the patient is very important. So it's very important to consult in a vertigo clinic to find out the root cause of their vertigo.
Thank you so much. That's Dr. Vishal, who is a specialist neurologist at Prime Hospital. Thanks so much. It's Channel 4.